Joining us now is the Surgeon General, Dr. Jerome Adams. He is part of the administration's coronavirus task force and the Trump administration's representative on our broadcast today. Dr. Adams, good morning to you.
Good morning.
I want to ask you about this cruise ship, Princess Cruises. The operator of that ship and the state of California have now announced some of the plans for the passengers. They're going to dock in Oakland tomorrow at a non-commercial port. The president said on Friday that he would rather people not be let off the ship. The vice president said they would. State of California says they would. Can you clarify what is happening to the thousands of people on board?
Well, we'll quickly get into the cruise ships, but what I want the American people to know is that the novel coronavirus comes from a family of viruses, including the cold, including SARS and MERS, which we've successfully navigated in the past, and that most people who get the coronavirus are going to have a mild disease. Very few will actually need to be hospitalized.
So for those people who are actually infected in this hotspot on this cruise ship, are they being released into the public?
Well, what we're prioritizing when we look at the cruise ship situation is, number one, making sure people who are sick on the cruise ship get the medical care that they need, that they're appropriately evacuated, and we've sent CDC teams onto the ship. We've sent personal protective equipment onto the ship. We're making sure, number two, that we can get people off the ship as quickly and as safely as possible. But we're working with the Department of Defense, Coast Guard, and the local authorities to make sure we have a safe place to take these people to, because we don't want to endanger the local community.
Does that mean that people who are infected are going to go to military bases all around the country?
Well, the plans are still being developed, but I want people to know that we are not going to put infected people into communities. Infected people will be quarantined, will be isolated appropriately so that we can make sure we're not putting communities at risk.
Okay, because the governor of Georgia has said 34 Georgians and additional Americans will be going to an air base. You're saying none of those people will be infected.
Well, there's a difference between quarantine and isolation. Isolation is where you put people who actually have tested positive. Quarantine is where you put people who've been exposed. We may be quarantining people in different places across the country while we watch them for 14 days to make sure they don't develop symptoms, but no one who's tested positive for coronavirus or who has symptoms will be put in a position where they can expose other people.
Okay, we're going to take a break and talk more on the other side of it, so stay with us, Doctor.
Thank you.
Welcome back to Face the Nation. We want to pick up where we left off with the Surgeon General, Dr. Jerome Adams. And I just want to button up where we left off on the matter of the cruise ship. If someone is exposed and testing positive, will they be kept in the state of California?
Some of those, well, we're still working out where we can best put those folks. You have to understand, these are four.
But they dock tomorrow.
These are four, yes, and that plan is being developed right now. There are almost 4,000 people on that cruise ship. We're working with the Department of Defense. The most important thing for American people to know is that folks who test positive will be kept isolated so that they cannot expose other people. We don't want to put communities at risk.
But people who do test positive could be dispersed to military bases around the country?
Well, we're going to try to keep them as contained as possible, but we're going to make sure, and as close as possible, but we're going to make sure they're in a place that we feel we can keep them from exposing the rest of the community.
And we should expect a decision on that by, what, the 4 p.m. meeting that you have at the White House every day?
Well, exactly. And again, I would refer you to Ambassador Birx for more information on that. We want to make sure the American people know that we're prioritizing the health of the people on that ship, getting them off the ship as quickly as possible, as safely as possible, not exposing the communities.
I want to ask you about, it seems that nursing homes in particular are very vulnerable. Older people are being advised, as you heard from Dr. Fauci there, to reconsider putting themselves in certain circumstances. Would you tell someone over the age of, 55, 60? I mean, what's the age group that you're saying should not get on a plane or get on a cruise ship?
Well, great question. And we've got new data emerging. We know that the average age of people who are dying from coronavirus is 80 plus. We know that the average age of people who are needing medical care and advanced medical care is 60 plus. And so what we're telling folks is that if you're in an at-risk group, meaning you're elderly and or you have comorbidities, heart disease, lung disease, you're immunosuppressed for whatever reason, that you should be taking extra precautions not to put yourself in a situation where you may be exposed.
What if you're pregnant?
Again, that if you're pregnant, I would advise taking extra precautions. But that said, no one under the age of 30 has died of the coronavirus in South Korea. No one under the age of 50 has died of coronavirus in Japan. There's something about being younger that is protective. But if you are in one of those higher risk groups, we suggest you avoid crowded spaces. We suggest you avoid potentially going on a cruise or taking a long haul flight, because most people are going to be fine, but we want those folks who we know are at higher risk for complications to protect themselves.
But New York State declared an emergency, and they have said you can't have visitors until further notice. I mean, should other states be doing this? Would you advise other states to do this?
Well, that's one of the reasons the Vice President and I have been going around the country. I've spoken with three governors in the past week saying, you need to be having these conversations right now. And I would encourage folks to go to cdc.gov. There is specific guidance for audiences, businesses, schools. I met with the National Association of Evangelicals, faith leaders. We want them to be thinking now about what their triggers would be, but the risk is going to be different in different places. What you're going to do in Seattle is going to be different than what you're going to do in Jackson, Mississippi, for instance.
So you've been a state health commissioner. In fact, you were one under then Governor Mike Pence.
And we dealt with Ebola, we dealt with Zika.
And yes, the largest HIV outbreak from intravenous drug use.
Yes.
And some point to that fact, and in fact, it was a criticism from Senator Murphy here, that this administration has been slow to respond to this virus. Given that Vice President Pence and you, same team, different situation, how do you respond to that? That there was a slow response then, there's a slow response now?
Well, I'd rather talk about coronavirus, but it's important for folks to know that
but the speed of the response specifically is what he was criticizing you for not having kits in place, for not laying the groundwork.
I appreciate the question. Syringe service programs, which folks really are looking at as stemming the tide of HIV transmission in Indiana, were illegal when Governor Pence took office.
He was talking about testing kits for coronavirus.
Well, okay. And
not being ordered.
And I was referring to the HIV situation. Governor Pence showed leadership in that situation. Syringe service programs were illegal when he came in. They were legal when he left. He actually was one of the few governors from a red state that actually expanded access to care, which helped in that response. And so we have the right person in charge of this response right now. And it's a recommendation of a panel that Susan Brooks led in Congress in 2015 that the Vice President lead just such a response. Now, as far as the coronavirus is concerned, we've been leaning into containment initially, which is trying to keep the virus from entering the country. We now are seeing community spread, and we're trying to help people understand how to mitigate the impact of disease spread.
Containment didn't work. Now you're looking at mitigation.
Well, containment worked to slow the introduction of the virus and give people time to prepare. And now we know that communities need to look at how we deal with community spread, and things such as social distancing, not having large gatherings, pulling down events. Those are conversations that communities need to be having right now.
Thank you very much, Doctor, for coming and telling us.
Thank you, and stay safe by washing your hands, by covering your cough, by staying home if you're sick. Masks do not work for the general public in preventing them from getting coronavirus.
All right, and elbow bumps. Thank you very much.
Thank you.
Doctor, we'll be right back with former FDA Commissioner Scott Gottlieb.